25,000 views of our webinars so far. We're forging new partnerships, signing agreements with 12 other international academic societies, and building an enduring network we hope will last for many years to come. So, what can you expect from us? Free webinars led by key opinion leaders from around the world and across all fields of orthopedic surgery and traumatology, as well as chat shows with some of the most interesting and inspiring surgeons on the planet. Opportunities to take an interactive role in these webinars by participating in polls and live discussions. Free on-demand Pioneer playback service. Watch our webinars again and again in your own time. And coming soon, our new bespoke learning management system will host podcasts, an online version of the famous SICOT diploma exam, virtual training modules, surgical technique courses, a discussion forum, and much, much more. We hope you'll join us on this pioneering journey as we push the boundaries of what is possible in online orthopedic education together.
A very warm welcome to the Global Pioneer Fan Club joining us this Friday evening. And I'm Gowreeson Thevendran, consultant orthopedic surgeon from Mount Elizabeth Novena Hospital in Singapore. I'm the immediate past chair of SICOT's Education Academy and one of the founder members of SICOT Pioneer. Today, we plan to discuss the value of establishing and cultivating diverse and purposeful personal and professional networks throughout the various stages of an orthopedic surgeon's life and career through a mentoring perspective. We're very fortunate today to have 6 different panelists from hugely varied backgrounds, bringing us their own unique perspective from a combination of clinical, academic, as well as professional ecosystems. Amongst others, we have our very own SICOT president, Vikas Khanduja, himself on the podium, the founder and past president of IODA, International Orthopaedic Diversity Alliance, Jenny Green, the chair of IODA's Mentorship Committee, Dr. Valeria, who's also moderating the session, and of course, our very own Education Committee chair, Dr. Sasi. I'm very thankful for your time and effort. Our moderators today will individually introduce each panelist before their talk, and I'd like to take this opportunity, however, to introduce 2 invited panelists who come to us from outside the orthopedic circle. Professor Chandran Kukathas is Lee Kong Chen Chair of Professor of Political Science, School of Social Sciences at SMU, Singapore Management University. He was head Department of Government at the London School of Economics and Political Science from 2015 to 2019. And prior to that, Neil A. Maxwell Professor of Political Theory at the University of Utah, and he's taught at multiple other universities prior to that. He's a highly regarded political theorist, best known for his contributions to multiculturalism and on the understanding and assessment of Hayek's political philosophy. Chandran is a prolific writer, published extensively in leading academic journals and non-professional journals, and he will be telling us today about the organizational behavior and the challenges of building a mentoring ecosystem within an organization. Sir John Bittleston is the founder, executive chairman of Terrific Mentors International, the only honorary member of Asia Institute of Mentoring. He's an active octogenarian who loves mentoring, and during a successful corporate career spanning advertising agencies and FMCG, John has run, has built, grown, and even sold various profitable businesses for his parent company. An author of children's books, a columnist, he still publishes 3 to 4 articles every week, of which I read and partake in excitedly every week. He and his wife, Eliza, subsequently founded what is now Terrific Mentors International over 30 years ago. Using his unique blend of experience, wisdom, and keen interest in people, John has built a career as a business mentor, a coach to thousands of clients, many of whom just have benefited hugely from his experience. So to Chandran and John in specific, thank you very much for taking your time joining us on this podium. We're very grateful. And to all of you watching, please share your questions, post your comments, and our moderators will take them as we go along. And on that note, I hand you over to our chairs, Dr. Sasi and Valeria, to take you on to this session. Sasi, over to you.
Thank you, Gaur. Thank you very much for the introduction of all the speakers. I'm Dr. Saseendar, Chair of the Education Committee of SICOT. I have with me Dr. Valeria. Dr. Valeria is consultant foot and ankle from Institute to the Orthopedia Jamie Skeletal and Sanatorio Britannica from Argentina. She is also the chair of the Mentorship Committee of IODA. I also welcome Dr. Jennifer, one of the founding members of International Orthopaedic Diversity Alliance, and it's a great opportunity to have this collaboration between SICOT and IODA. Dr. Vikas Khanduja is running late with another presentation, so I'm going to invite Dr. Jennifer. Dr. Jennifer Green is consultant hand and wrist surgeon from Canberra Hand Centre, Canberra, Australia. She is IODA Governance Director and past president. She is also Australian Hand Surgery Society Secretary. I invite Dr. Jennifer Green to talk on diversity in mentorship building, inclusive pathways to success. Over to Dr. Jennifer.
Thank you very much, Sassy. I'll just share my screen. Now, is that good for you?
Yeah, looking great.
Excellent. So thank you again for the invitation. It's wonderful to have this collaboration with SICOT, and I will get going. So what I'm going to talk about today is mainly the benefits of diversity, of mentorship for the purposes of building diversity, being a very non-diverse organisation in most orthopaedic societies. So firstly, a couple of brief things. What is diversity? It's not really an ideological argument. It's an evidence-based strategy. So back in 2015, McKinsey, who is a very large multinational company, put out their Delivering Through Diversity report, and it showed that organisations with more than 30% diversity attract the top talent, they're more innovative, and they make better decisions. But most importantly for this presentation, a lack of diversity in the surgical workforce leads to persistent healthcare inequity. Just a mention about unconscious bias. These are unconscious thoughts that are influenced by many factors, and acknowledging that we all have these biases and understanding them is one of the first ways we can mitigate our bias and improve our inclusion. So there are lots of different types of bias. There can be affinity bias, where you have a really great feeling of connection to people like you. I'm sure we've all felt that one. Perception bias, where we stereotype people, or the halo effect, where we think people can do no wrong. And on the flip side, confirmation bias, when you think someone's not a great at whatever, and when they do something wrong, you confirm that in your mind. If you haven't seen this, I think it's quite interesting to just think about all our different societies. This is a North American model, and how some people are central to the power and privilege, and others are quite marginalised. And we have a similar issue in certain areas, and this will vary a bit for every community that we live and work in. So why do we want a bit more diversity in healthcare? There are quite a lot of gender diversity disparities in orthopaedic care for conditions like carpal tunnel syndrome, knee arthritis, hip arthritis, ACL injuries, ankle instability, lumbar spine arthritis. The list goes on. There are also a lot of papers out there about racial disparities in orthopaedic care, and those papers are growing in number all the time. There are higher amputation rates after lower limb trauma and poorer access to joint replacement. And children of non-English speaking background get delayed orthopaedic care. So we know from this and many other studies that diversity of healthcare teams improves performance and outcomes for patients. Diversity means selecting from a wider talent pool. So you attract the top talent, just not that smaller group of people that we know form the majority of orthopaedic surgeons. There are a lot of barriers to diversity. ChatGTP cannot spell unconscious. They include lack of leadership, lack of mentorship, problems with not enough visible role models, unconscious bias, and lack of flexibility in the workforce. I'll discuss these briefly. We are having a lot more female and also multi-national people of many different cultural backgrounds in our more diverse societies. Early exposure we know is particularly important to engage with medical students, and we do this quite actively with our Indigenous students and our female students to encourage them into orthopaedics. And we need to be aware when we're selecting people into professions that we have diverse interview panels. If you don't have enough women, we have included in Australia anaesthetists and other types of specialists. And then analysing your data and seeing who you actually are selecting and how you can make selection more equitable. It's important that you're aware, if you're one of the majority, that women and minorities are quite a lot less embedded in networks, and this is where mentorship is really important. We often lack access to crucial information and contacts. We don't find out what's going on, and we're unaware of opportunities. And one of the first things I did when I sat on the orthopaedic board in my nation was to make sure that we advertised every opportunity and we didn't shoulder tap people that we knew. And we can increase diversity by including more diverse faces and names on our scientific panels, even as guest speakers, but also as moderators, just giving everyone a chance to be seen and to participate. But most importantly is leadership. It drives the most effective gender diversity initiatives. We don't have all the answers yet for more cultural diversity issues and also for LGBT. We know that you're less likely to pass surgical exams if you are married or have children. And so it's important that we have a bit more flexibility in training if we want to attract those excellent female medical students. And that can include many different things. I just wanted to differentiate quickly between mentorship and sponsorship. A sponsor is someone who has power and will use it for you, someone that's going to invite you onto a committee or offer you a job or introduce you to someone that has the position you can fill. So mentors talk with you, but sponsors talk about you, and mentors help you skill up, but sponsors help you move up. And increasing gender diversity, increasing cultural diversity, these are things that can't be just the work of the women and the minorities because we make up a very small number. So the allyship of our colleagues is incredibly important, and having mentors who are allies is a really great way forward. And I'd encourage all of those who are from the majority culture in the organisation to reach out to those who are not. And even if it's just for one minor opportunity or to give them some advice. I want to take a couple of minutes just to talk a little bit about some of the evidence in gender disparity in the research field in orthopaedics. In basic science research, there's a study over 10 years that showed only 3% of the orthopaedic papers analysed for gender differences. And overall, in our clinical research over many studies, the actual analysis of gender is only about a third. So, last time I looked, women were 50% of the population. So we really need to understand what works in our outcomes for women and men. And we know that from studies that female authors are more likely to include women. A lot of our orthopaedic patient-reported outcomes are biased towards male occupations and male sports. In fact, an 8% gender difference can be found in non-symptomatic patients. So that translates very quickly to clinically significant differences. In research funding, women only receive 55% of the research funding compared to men. And women recipients were more likely to be from departments with a female surgical chair or a department with more than 30% female surgeons. We know that abstracts by women are less likely to be published, even if there are no differences in the average sample size or levels of evidence. But the top 5 women in major orthopaedic journals had more publications than their male peers, however, were much less likely to be cited. And part of this is to do with editorial boards where women are generally underrepresented. And unfortunately, they actually submit more thorough reviews and recommend fewer articles for publication, which has a backhanded disadvantage because they're asked to look at more female-authored manuscripts. So this is just perpetuating the lack of acceptance of female manuscripts. So, mentorship's really important, particularly in orthopaedic research. Our leaders are orthopaedic academics. And so mentoring diverse people into orthopaedics is key, and particularly diverse research teams, diverse research methods and questions. We know that it will improve diversity, and I'd really encourage everyone to consider mentoring someone who's an aspiring orthopaedic surgeon or a junior colleague who is different to you. And IODA is going to be launching a global online mentorship program in December, and all members will be welcome to join. Thank you very much.
Thank you very much, Jenny, for your excellent talk. I believe we are going to go next with Sasi. Are you okay, Sasi?
Yep, perfect.
Okay, so you can share your screen. Sasi has already been introduced, so you can go ahead with your talk.
Thank you, Valeria. I'm going to speak on my experience transitioning from student to surgeon, the impact of mentorship or the absence of it in my orthopedic education. To talk about this, I'm Dr. Saseendar, Professor of Orthopaedics. To talk about this, I would like to go through some of my failures and challenges. And I'm sure a lot of orthopedic surgeons from around the world and also from developing countries can reflect upon this. The first failure or challenge in my medical career came in research. That was in my first year of MBBS. It was my first research project. It was supposed to be a 2-month studentship under the Indian Council of Medical Research, the top research body of India. It was supposed to be a 2-month program, but I was working on the program, on the studentship for more than a year, and it was not going anywhere. And finally, I had to discontinue with a lot of sorry face and also face the mockery by the guide for not completing the study, even though I had overrun the program duration by a long time. So what went wrong? Should I not say no? Or was it the way I said no? Or the time I said no? Where do I get the answers? These are some questions I never got the answers, but possibly the lesson is to set realistic goals. But who sets the goals for a first-year medical student? Definitely not you, right? A significant other challenge that I faced was about choosing my subspecialty when I completed my orthopedics for graduation. Initially, I was inclined towards pediatric orthopedics because my thesis was in pediatric orthopedics, but Unfortunately, it did not seem like an attractive option in my locality and provided my demographics. So I started exploring other options, and joints was something that attracted me. That included arthroplasty and arthroscopy. But over the subsequent years, I settled down to arthroscopy, not because I liked arthroscopy more than arthroplasty, but because arthroscopy was the one in which I got a good hands-on fellowship. So, should your subspecialty be a choice of exclusion, or should it be a decision of choice or a decision of chance? Again, questions to ponder. Continuing the upskilling and fellowships, I did a trauma fellowship sponsored by Centers. Then I completed a traveling fellowship to the USA, Switzerland, UK in arthroplasty and arthroscopy. Went on to work in India in a tertiary referral center, and then also did the long-term hands-on shoulder and elbow fellowship, and then returned again to India to work. It all looks green to see, but retrospectively speaking, there are a lot of possible changes that could have made things better. My post-graduation lacked specialty training. That was something that possibly could not have been changed. But after the trauma fellowship that I did, I was promised hands-on training, but it did not happen. So what do I do about it? Should I discontinue? Should I ask for more? Or should I settle for less? No answers for this. Regarding the traveling fellowship, should I have done the traveling fellowship immediately after a trauma fellowship? Or should I have waited until I completed a full hands-on training and subsequently done a traveling fellowship? Possibly it would have been, the second option could have been better, but who was there to advise? And also, the tertiary center that I initially worked did not have the opportunity to work in the fields of arthroscopy and arthroplasty. So was I downskilling myself after completing a fellowship? So these are certain things that could have been improved in my career retrospectively, looking at it. Also, the question of the locality of practice, to practice in the peripheral village or a peripheral center or in a town or a metro city, it all depends on the scope of the subspecialty, the long-term goals, whether you have family support or whether you have a family to support. These are difficult decisions that have to be made, and some advice or support can very well help you in this. In my career, I started my initial practice in a smaller town, upskilled, went back to the smaller town with minimal possibility to use my skills, so possibly downskilling, went on to another fellowship, and then returned to a metro city where I could execute my skills. These are something that could have been improved, done better, but not all went south with my career. I did other fellowships. I had a lot of friendships. I improved on my subspecialty. I'm involved in a lot of clinical teaching. I'm also involved in SICOT-IODA, where I'm part of the team that establishes modules in arthroscopy to train others. I also have done multiple first-time surgeries in whole of India. With respect to research, I went on to complete other multiple projects, continue to do clinical research. I sit on editorial board of index journals. And also being attached to societies like SICOT and IODA has given me the recognition that I need for further collaboration. Collaboration also helped me to contribute as author to chapters of books and also publish books as editor-in-chief. So what is the story? I did succeed, but does that mean that I have to fail before I succeed? It's not always necessary. It's not always necessary to have the confusion, uncertainty, psychological and physical pain before you have to succeed. What you should do is ask for help. But did I ask for help? Did I not get help? I did. I had a lot of people who had the best of intent and advised me, but asking questions and getting the answers is different from being mentored throughout the way. That is mentorship. So what is mentorship? Mentorship is using one's wisdom, experience to help another person build their own wisdom And this does not come only by question and answer. Someone monitors you and supports you and uplifts you. When should you ask for help? When should you ask for mentorship? The problem is we never think the time is right for asking for mentorship. It's well said that the early days are the times when mentorship is best useful, whether it is medical school or it is during residency, but that's not all. Dr. William Levine, an established arthroscopy surgeon from Australia, he says when he was being recruited as the chair of a certain society, he did get mentorship and support from the chairs of other societies, and it was well helpful. So, time and age is not a matter for mentorship. Everyone requires mentorship. Also, the mentor also gets to train and improve himself by getting educated during the process. So, having said that, do some people need more help than others? Yes. Some underrepresented minorities, surgeons from less developed countries, and women have less access to mentorship. And so it is also logical that they have to be provided better access to mentorship in addition to providing mentorship to every other surgeon. So are mentors to be blamed for everything? Mentors can solve everything, every other problem? No. Mentorship is not a one-way story, it's a two-way street. Both the mentor and mentee have to work together just like a marriage in order to make it work or successful. In addition, the mentors also need self-confidence and humility to be able to uplift the mentee to be as good or even better than him. Dr. Levine also sets down certain guidelines that both the mentor and mentee preferably should have in order to keep the relation flowing. So, to end it all, it is okay to ask for help, knock the right doors like SICOT or IODA. There are mentorship related activities going on. IODA is coming up with a mentorship program. It is okay to ask for help and enjoy the path during your training, not only the outcome. Be okay with not having all the answers, but believe me, you will have a better path towards your goal. So the take-home message is mentorship is a win-win situation when used well. It can minimize detours in your career and accelerate your success. But some ground rules are needed. The mentee should have integrity, should be available, and should be understanding. The mentor should be self-confident and should have humility. Thank you.
Thank you very much, Sasi. I believe we have some questions on the chat, but we'll take 15 to 20 minutes at the end of the talks so we can share some answers. Okay, so next, I believe we're going to go with Dr. Vikas Khanduja. Is that okay? Is Dr. Khanduja here? Okay, so also already been introduced, but I will make a quick presentation. He will talk about the power of personal connections and how mentorship can transform careers. Dr. Vikas Khanduja is a consultant hip and knee surgeon. He's an Addenbrooke's Cambridge University Hospital in the UK, and he's British Hip Society past president and SICOT president. So, Dr. Khanduja, it will be our pleasure to listen to you.
Thank you very much for the kind invitation, and sincere apologies for barging into this a bit late than scheduled. So the remit for me is personal connections and mentorship, and I'll try and take out pieces from my own career and probably highlight those into specific points for this talk. So bring you greetings from our biomedical campus in Cambridge, and would be delighted to host any one of you who would like to visit. And a big thanks to IODA and Jenny for coming in as a collaborative partner on this webinar, which will definitely, I'm sure, have lots of views as we go along, both now and later on as well. So if I look at personal connections and the value in terms of mentorship, I probably think of four things. Essentially, it almost acts as a good support system. There is a fair bit of knowledge transfer. You're learning from the experience of the mentor and a fair bit of advocacy as well. And finally, huge opportunities are provided by the mentor or the mentee and vice versa. So if I look at my own career in terms of professional growth within the society, I think there are two individuals whom I would like to acknowledge. First is John Dormans. He's a spine surgeon in the States. And I was a young trainee when I met him first, about 18 to 20 years ago in SICOT. Really looked up to him. And over the years, he really became a strong advocate and a mentor. And I've learned an immense amount of organizational handling from John Dormans. The other one is Professor Rajasekharan. He manages the Ganga Hospital in Coimbatore. Has probably been the leader of every organization that you can think of, both nationally and internationally. And again, an immense source of knowledge in terms of organizational leadership, handling difficult situations. And every time I met these two individuals at meetings or otherwise, we just get a wealth of information on how to handle difficult situations in organizations. And they became very strong advocates of me in SICOT over the years. So if I have to thank two individuals in terms of learning how to climb up the ladder in an organizational, both organizational leadership, then I think I would thank these two individuals. And I'll talk a bit later about how to actually develop these relationships. But these personal relationships are extremely important. So professional networking, important to build your relationships and expand one's own professional network, because you would have shared experiences and perspectives, which would also foster deeper connections and understanding. And the trust and support that you develop, they are really critically important in maintaining and developing your professional relationships. Now, that's the organizational side of things and leadership side of things. Now, within the orthopedic circuit and within my own arena of hip and knee surgery, two individuals again come to mind, and that's Professor Eudoro Salvati. I did my fellowship with him at HSS New York. And the other Cambridge, accredited during the first hip arthroscopy in the UK, and he's been a true mentor from a subject matter point of view. And again, both these individuals have I can actually pick up the phone and discuss complex cases with them, even to date at any time. Any difficult patients that I'm encountering on a subject matter, I can actually ring up or text them and discuss with them. So they're always available, and vice versa as well. If they've got issues, they can discuss patients with me in their own career. Both of them are retired now, but it was a two-way street from both point of view. So from a professional point of view, they have been immensely helpful, both in my growth, and I hope I've supported their growth to an extent as well. So the benefits of having a mentor, both on the professional side, on the personal side, or actually in your organizational leadership, is huge. Obviously helps your career advancement. Skill development is key. So mentees gain valuable insights and skills as well. They create networking opportunities, and you get an increased sense of confidence, and that boosts and that shows both in your leadership skills and otherwise as well as a doctor. Now, what are the types of mentorship, and how do you identify that this is the right mentor for you? You could obviously have formal mentoring, you could have informal mentoring. I've technically always believed in informal mentoring. You could have reverse mentoring. In terms of identification of mentors for junior doctors, I think networking events, pretty much our annual Congress in SICOT gives you the access to almost 250 to 350 key opinion leaders from around the world. That's really good. So, and then there are formal online platforms as well, which actually run mentoring courses and coaching courses for you. Now, how do you write that compelling email or introduce yourself in person? Probably the best way is if one key opinion leader actually introduces you to another to build your relationship. And that then actually goes forward in a long way. Now, I'll actually play a clip for you. Hopefully this works. This is me interviewing Richard Willer, the guy I just showed, as a part of the British Ship Society Legends podcast. And we'll hear what he has to say about mentorship. Let's just see if this works.
It was that day, and that's all. I became an orthopedic surgeon.
Were you playing rugby at the time?
I wasn't playing rugby. No. I wasn't the patient. I was the student.
So if we look at mentoring now, how do you think they compare? And do you think we are actually heading in the right direction with formal mentoring programs, or do you think it should be more informal and more based on friendship?
Well, mentoring is important. Personally, I think it's very difficult to say to somebody, you are a mentor. Sometimes you get it right, sometimes you get it wrong. It's rather like saying to somebody, you are a leader or you are a manager. There are some people who can do it and some people who can't, and that's all there is to it. Mentors, in many respects, just emerge. I don't know what it is, but there's clearly a link between two individuals, and that's the way of it. In a way, a mentor advises without appearing to advise, like a leader leads without appearing to lead, like a manager manages without appearing to manage. And if you manage that, achieve that, then you're doing well. So my mentors, look, when I was in my training, my mentors in many respects were just those people who trained me. I then became a junior doctor. And it's quite interesting. I joined the army and then I wanted to get out. And who was I going to go and see? Who would I ask about that? And so I went to see actually my first ever consultant. He was called Sir Hugh Lockhart Mummery. He was actually the Queen's surgeon, but he was a really good guy. And you knew when you were sitting in the room with Sir Hugh that you were just getting Sir Hugh's view, and it was unencumbered by any politics or anything else. I think I did exactly the opposite to what he recommended, but that's not the point. We both felt guilty and we both felt happy, if that makes sense. I then became, it was that day I became an orthopedic surgeon.
So just highlighting the importance of how mentorship can be either the formal mentoring programs that probably SICOT is looking at or a British Ship Society looked at, or you could just have mentorship as Ricky Willer describes, pretty much a friendship, and then you develop on that. So I have actually believed that mentorship relationship is really important. So I'd advocate regular communication, active listening, and more important, showing appreciation, because eventually it's the time. And if you look at the current generation, the attention span is fairly minimal. I've got 20 to 30 people coming up to me at every Congress. They're probably spending 30 seconds with me, and then they would want advice and mentorship. How can you actually develop the relationship with that individual if the amount of time that they're spending with you is so minimal? So I really advocate spending time, being one-to-one, and then over a period of time, you will start achieving your goals, overcome challenges, and developing new skills. The other mentor I have, and he continues to be a good friend and mentor, is Mo Bandari. And he strongly advocates something called micro adventures. So as and when we get the time, this is in Malaysia, we were there at a conference, we were out for 6 hours on this micro adventure, climbing these places. and doing things. And in those 6 hours, the amount of information or the amount of wealth of advice that I got from him was immense. So you cannot do that in formal mentoring programs in an hour or in half an hour. And you really need to invest time in relationships, and then you start getting a lot out of it. And he always says, it's not about me spending time with you and you getting it. It's going to be a two-way street. I'm going to learn from you, you're going to learn from me. And that's how it actually develops. So invest time in that. And then the ripple effect of mentorship is huge on careers and communities. Individual growth, you enhance skills, career advancement, all that you will get from books. But important thing is to actually spend time. But your network is really your net worth over a period of time. So you may have 10 mentors over a period of time, but those 10 mentors are actually going to be your net worth because they're going to create thousands of opportunities for you. So if I look back over my career of over 25 years, then essentially it's been these individuals who've been key, and they continue to be, both in terms of advice and friendship. Thank you very much, ladies and gents, once again, and happy to take questions, and apologies for the delay in getting to you.
Thank you very much.
Thank you very much, Vikas. Thank you for the wonderful discussion and pointing out that personal relations is the way to go. Thank you very much. Now I would like to invite Mr. John Bittleston. He is chairman and founding mentor of Terrific Mentors International in Singapore. I would like to invite Mr. Bittleston to talk about finding the right mentor. Over to John.
Thank you very much. You've invited me, and I'm very honored to be here to talk about how do you find the right mentor. I'm going to make an assumption here that you want your mentor and coach to help you develop in both career and personal terms. Mentoring is always about life rather than just about career. How do you know if you need a mentor or coach? People need both, and both overlap anyway. All the people who work with me are called mentor coaches. Their primary job is mentoring, but they work as coaches when the client's need arises. I'm looking for a mentor coach. You ought to have the option of choosing a friend who will devote time to you, or hiring a professional who will charge you money, but who you can expect to give you good, consistent, and timely service. The first need is for someone who is up to date with the world you live in, socially and commercially. Change is endemic and very fast. Your mentor coach must keep up with it. She or he doesn't have to be exactly of the same world as you. In fact, it's better for them to have a wider experience than your own. Look for a mentor coach who's been successful, but is not too narrow or over-specialized. Mentoring is not about the latest Intel chip. It's about a rounded life. Mentoring is a depth exercise. Whether you go for a professional or an amateur, look at the people of stature that you meet. Not kings and presidents, but a person who's made their way in the world, who's respected for what they are, not for what they've got, and who's interested in other people. A good mentor asks the right questions. The best mentor also questions the answers he gets. A mentor coach helps you recognize who you are. People often think they know who they are. Sadly, that's not the case. Of the many people who completed our PASDAC Personality and Purpose program, every single one has said to me, wow, I never knew all that about myself. Choose someone with good intellect and the creative ability to perceive relationships. Creativity is vitally important in your world, both in diagnosis and in development. The creativity is also important because it will help you. What they have will help you with yours. In today's world, creativity is the human ability to retain control of AI. You need someone lucid who must be understandable. You and they do not have a lot of time, and you must make the most of it. Your mentor coach must be tough. Discipline is an important part of a successful life. A client recently told me that I could be a harsh blessing. I don't like being called harsh, but when I thought about it, I was glad that my client understood the harshness he saw also had the blessing he understood attached to it. Of course, your mentor coach will talk about their own experiences and the lessons they've learned, but your best lessons will come from what you tell them. So your mentor coach must be good at listening and asking, not forever talking and telling. She or he must question your answers. Mentoring, coaching is like a mind game. It works best with a challenge. Every question you get is an exercise of your mind. That's how it develops. You need a kind, decent mentor too. She or he is not there to judge your life, but to help you improve it. You're the only person on the planet who judges your life. We're accustomed to our clients, however senior, rich, or powerful they are, resorting to tears when they discover who they are. They're not tears of sorrow. They're tears of confidence, and they're tears of joy for where they've come from. They're tears too of joy for where they're going. Your mentor coach must give you workable amounts of time, not too much because you're busy, but also not just for a quick fix. At the end of working with a mentor coach, you should be able to stand on your own feet, not on theirs. Your mentor coach should have experience, but beware of experience-only mentors. The best definition of experience that I know is it lends precision to the craftsman's tool and confidence, but leaves a fool a fool. Well, we all know experienced fools, don't we? So where do you find this broadly based, kindly, disciplined, interested, and experienced person? May I suggest that you should be looking for them all the time, right through your life. Such people are rare, and it's even rarer to find one with the time to devote to being your mentor coach. I was fortunate in having two outstanding mentor coaches in my lifetime. One when I was 22, just starting out in London. He became a member of Parliament. He helped me navigate for 10 years. Much later, when I was 45, my boss became convinced that I could do better. He mentored me for over 20 years. After I sold the international business I developed based in Singapore in 1990, I started our business. I called it Terrific Mentors. What that lacked in modesty, I expected to more than make up for in quality. Like all good mentor coaches, we provide navigation that enables you to stand on your own feet, rather than answers that deal with only today's short-term issues. I've had many, many fascinating jobs in my life and been to lots of interesting places. Being a mentor coach is proving to be the most rewarding of all the experiences I've had. I'm John Bittleston of Terrific Mentors International. You could contact me if you wanted to at mentors@terrificmentors.com. Thank you.
Thank you, John. That was a very depthful presentation, and thank you for sharing your knowledge. Now, I would like to invite Dr. Valeria. Dr. Valeria is the chair of the IODA Mentorship Committee and consultant foot and ankle surgeon. She is going to talk on building a successful mentorship program. Over to Dr. Valeria.
Hi, Sasi. I will try to put into some bullet points, and I will try to make it as quick as I can. What already have been stated by our amazing talks previous to the mine. So I will try to talk about some key points of what make a successful mentorship program successful. And purpose is probably the most necessary one. A successful program should have a well-defined goal, and that should align with the mission and with the vision of the organization that is built in. A highly intentional pyramid that is not easy to do. Sometimes it's very intuitive, but this could be make purposeful and it could be intentional, and it's also a key factor. It should be diverse. Jenny has already shown how focus on diversity and it not only includes women but also some underrepresented groups into the field improves our organizations. It will be structured but flexible to accommodate some personal variations between the mentor and the mentee pair. It should promote accountability and in sort of a positive loop. It should promote engagement and that two-way street that was already talked should be present. Its impact should be and has to be tracked in terms of success, of goals achieved, and this should be part of the feedback. And the leaders of the organization that the mentorship program is built in should be supportive, should be actively supportive. Diversity is, as opposed to tokenism, should be transversal to every program of mentorship. I will not talk about how necessary it is. Jenny has already done it, but we should be purposeful. We should be intentional with being diverse in our programs. And I will talk just some specific points on how to establish and build a successful mentorship program. Clear objectives are key, are absolutely key. And this probably needs a previous survey on what do we want to do with our mentorship, where do we want to direct our training, what kind of relationships will going to need to be taken into account. The recruiting of mentors and mentees, both mentors and mentees, should be active, should be intentional. We need to get to as many people into the field of interest as we can, and this should be using an appropriate language and target some affinity groups and collaborate with some organizations that we believe are going to be useful for our mission. Partnering with diversity, equity, and inclusion initiatives, it's also a good way to find diverse mentors. Focus on some tailored program goals will also define and refine the definition of mentors and mentees we're going to get to our program. Fostering inclusive mentoring relationship is key, and this I believe it is valid both for formal programs or informal mentorship relationships. A clear and open communications with some ground rules that should be established in advance for the program, and train the mentors into support the specific needs of the mentees, and provide this inclusivity training, which is not so intuitive as you may think. It's also very, very important. The training and its different variation, it's absolutely a necessity. training on communication, training on cultural competence, and understanding that the bias, the empathy, promoting some cultural sensitivity, setting the goals for the mentorship, goals that are trackable, that are reachable, that are well planned, and how to develop that planning throughout the mentorship, and how to resolve conflicts should be abilities that need to be trained in mentors. And this could be by building a toolkit, by organizing support or peer coaching groups, and that should be tailored to the necessities of the specific mentors. Monitor and evaluating each program is fundamental. Identify what metrics would be relevant, establishing some performance indicators, and doing some checkpoints regularly throughout the mentorship to see if the goals are being accomplished. Collect feedback from the mentee, from the mentors in whatever form you see fit is also fundamental. Understanding that some groups might have unique necessities and different needs helps some way to level the playing field and probably ensures the success. So tailoring the necessities of training to the specifics of the program is also a must. I will stress that diversity needs to be purposeful and intentional in identifying barriers and identifying and being sensible to experience will also constitute a part of the pairing and of the training. And again, culturally competent training, specific culturally competent training, it's a must for mentors. Creating throughout the mentorship safe space for open dialogue, encourage open communications, insert some inclusive discussion topics will also expand the diversity into our mentorship program. And Jenny has already announced it, and I will thank her for her enormous effort. IODA is launching on December built-in mentorship program. Pushfar will be our platform, and all of these bullet points that I tried to sum up during this small talk will be built in this platform. So we encourage you to join us and enjoy the benefits of being mentors. I will not repeat myself on this, but whether you do it manually, whether you do it formally or informally, or you need a platform in order to do that, mentorship should be intentional. We should know some key points in order to be able to be an effective mentor. Some take-home messages: define clear goals from the beginning and try to stick to the goals. Tailor programs to meet diverse needs. And that will be adjusted to your audience and to your mentors. Try and foster inclusive relationships. Provide training in listening, training in awareness of bias, training in skills, and monitor each time you can, evaluate, and this will provide a feedback to improve. Thank you. I will stop sharing, and I believe, Sasi, that we have our last talk.
Yeah, thank you, Valeria. Thank you for your your presentation. I would like to invite Dr. Chandran Kukathas, the Dean of the School of Social Sciences, Lee Kong Chian Chair in Political Science from the Singapore Management University, to talk on organizational behavior and the challenges of building a mentorship program. Over to Dr. Chandran.
Thank you very much, and thank you for inviting me to speak. Let me see if the screen sharing is working. Yes, okay. So I am the Professor of Political Science at Singapore Management University. And so I come at this from a very different perspective than those who are in the medical profession or who are professionally mentorship coaches. So I'm going to speak to this on the basis of my experience organizing and managing departments of political science and philosophy. My experience goes to back to Australia, but also to the United States and the UK. And most recently, I've been the Dean of the School of Social Sciences at Singapore Management University. So the first question I think we should ask when we're trying to understand mentorship is to ask, who are the stakeholders involved? I think most obviously there are individuals, but there are also institutions, and there's the broader public. So I think when we ask about mentorship and why it's important, we have to distinguish who's important in this. Obviously, the individuals who are being mentored are important, but also the institutions within which they operate are significant because they have interests as well. And then the broader public has an interest. So what are the aims of mentorship? Here, I may be going over some things that are familiar, especially given the talks that we've already heard, but I think it's worth going over this if we're to understand what are some of the challenges of mentorship. So one obvious purpose of mentorship is individual career development. We're looking to the question of how we might guide the junior people who we come across or under our care, whether we're colleagues or we're people in positions of leadership. Their career development matters. And so one part of that means looking to how we might help them with the technical and professional elements of their development. But as someone has already pointed out, we're not just professionals. We're also human beings. We're also colleagues. We're also members of families and communities. So it's not easy to disentangle professional concerns with personal concerns. But this is one of the aims of mentorship, individual career development. The other thing that's important is team building, because typically we work not as isolated individuals, but as members of professional communities. And mentorship is important not only because it helps individuals, but also because it helps the professional organizations develop, in particular within departments or units. They can't function as effectively unless everybody is pulling together as long as everybody is of a single mind on important things, then we can actually make some progress and achieve goals. But if we don't think of it in those terms, if we simply think of it in terms of individual career development, we're going to miss out on an important dimension of the purpose of mentorship. In other words, we also need to achieve collective goals. It's not just individual goals we're concerned about. We're interested in what might be the goals of the broader organization. Another purpose that mentorship serves more broadly is developing the reputation of the institutions. Whether you're looking at a hospital or something that I'm more familiar with, a university. A university cannot function effectively unless it's made up not just of individuals, but it's made up of people who, to some extent at least, are concerned with developing their own careers in a way that's sympathetic to and an important component of the development of the institution's operation. Finally, we want to mentor people because our professions themselves have purposes. If we're medical professionals, or in my case, if you're in the social sciences, what you want is to do the job that you've been trained for. In the case of people in the social sciences, where their concerns are teaching and research, you want to become a better teacher, you want to become a contributor to the research in your discipline. Mentorship serves this particular end indirectly because it's only by the success of individuals and their careers that you can contribute to this. So this brings me to the question of what are the strategies then we might have to consider if we're going to address the challenges that are posed by the need for mentorship, because mentorship, we all accept and agree is important, but the question is, how do you actually achieve the kind of mentorship that's important? One option is simply to say, look, let's let the individuals initiate mentorship. People have been given advice to go off and seek mentors, people who might help them. There's nothing wrong with that, but there are limitations to this, and I'll come back to this in a moment. The other option is to say, as an organization or a unit, we take mentorship very seriously, so we will try to assign mentors to individuals. This is also something that's frequently been tried as a strategy. I've observed it in many institutions, including ones that I've worked in. It's important in some ways, but it has serious limitations, and I'll come back to that as well. Thirdly, there's the option of what I call collective mentoring, and I think this is, for me, what is something we need to think about most seriously, because the limitations of individual initiated mentorship or even assigning mentors through some sort of institutional requirement has very, very limited possibilities, in part simply because of the sheer nature of human beings. We're all individual personalities. We get on with some people, we don't get along with others, leaving these questions to the chance opportunities that come with people just either being assigned to tasks or becoming mentors because they've been nominated, or leaving people to go off to look for mentors themselves. All of these are strategies that come with certain risks. If we decide on a strategy of, say, benign neglect, where we leave individuals to look for mentors themselves, the problem is that this really only makes a difference if the individuals in question or looking for mentors are proactive, have the personalities to be confident about going and approaching someone, and who is lucky enough to find someone who is going to be a suitable mentor because there's no personality clash, because they are sufficiently expert in the subject, and they know how to handle the particular personality in question. So benign neglect, I think, is not going to be a successful strategy. The other option is to try to assign mentors to specific persons, to make sure that no one falls between the cracks, that everybody is going to be allocated a mentor of some kind or another within an institution. Not a bad idea in principle, but the danger here is that there are many people who are assigned the roles of mentors who have absolutely no interest in it, or who do not have the personality for it, or do not have the time for it because they have other responsibilities. So assigning this role risks ticking the box without achieving any of the purposes of developing the mentor-mentee relationship that we've all recognized as so important. The third possibility, I think, is the option of collective mentoring. And here, I think there's much more to be said for this, although there are also risks involved. What I think is involved in collective mentoring is not so much a case of a collective or a unit or a group assigning specific mentoring tasks to specific individuals who are senior within the group, but rather what it means is developing a community and an ethos which allows for individuals, all of them, whatever their personalities, whatever their expertise, however junior or senior or mid-level, to feel that they're actually a part of a community in which they have a role, in which they recognize leadership, in which they know that they can approach others, whether they're others at the same level as they are, or others who are senior to them, or others who are right at the most senior level of the unit in question. I think collective mentoring is the most promising way of thinking about mentoring, not as something that's assigned to a particular individual, not something that's the result of a serendipitous connection between two people, is something that's the result of the creation of a collective or a community in which everybody sees that they are both contributors and receivers of guidance. So for me, the most important thing really is to figure out how we're going to build that community of relationships that's going to make mentoring possible. And I think for this, the main takeaways I would suggest that we consider is that, firstly, mentoring is not just an add-on. Many institutions focus on their professional goals, their professional ambitions, their targets, whether it's research outcome or teaching results. And mentoring is something that's put on as a side, as something we ought to consider. And I want to suggest that it shouldn't be thought about in that way. It's something that should be a part and parcel of the way in which we develop a research or professional community. This means building mentoring into the institution. Again, not allowing this to be the result of, happenstance, the result of serendipitous connections that we many of us have been fortunate enough to make, but we also know of many people who've not been successfully mentored, and there are probably all too many people who've, as a result of a lack of guidance, disappeared from their professions. So we need to build this into the institution. And I think this means collective mentoring to a much greater degree. But this also is not something that's going to just happen spontaneously. And this is why I think finally the most important thing to recognize is the role of leadership. So here I think the important thing for people who are senior in their professions to think about how it is that they're going to build those communities that are going to allow people at various stages of career to act as guides, as mentors, as sources of advice and instruction and guidance throughout their terms within the unit or the organization or the institution. And I think from this, it's possible for to develop all the kinds of things that my previous speakers have mentioned. I think this is the thing that we need to be thinking about, which is not to disagree with anything that others have already said, but really to raise, I think, another important issue, which is how do we bring about the kind of mentoring that we all think is important? Thank you.
Thank you, Dr. Chandran. Thank you for the thoughtful presentation of the organizational aspect of running a mentorship program. We will go on to the discussion. To start with, I will ask all the speakers to give 2 to 3 tips on what they feel is the best for mentorship. I will start with Dr. Vikas because I assume Dr. Vikas is running short of time and has to move for another meeting. Dr. Vikas, can you talk about 2 to 3 points that we have to keep in mind with respect to mentorship in relation to your talk?
Thanks very much, Sasi. I think from a personal perspective and the talk, I would say that the 2 strong tips would be spend time with the mentor and make it a friendly association that you build over years. That's number 1. And secondly, the power of micro adventures is really huge. Getting out of the building, doing something completely different, takes your mind away, and you're just talking as 2 good friends. I think those 4 or 6 hours is phenomenal. You'll gain a phenomenal amount from that. So believe in micro adventures and as far as possible, do them on a one-to-one basis. So that's as far as my talk was concerned. But I was really intrigued by what Chandran was saying, and institutional building in mentorship within the institution is definitely a top agenda for me in my presidential term. And we really need to bring in mentorship within SICOT, both for developing leaders for the future and also for helping you in your professional relationship. So we've got a clear roadmap plan for that, and we will discuss that at a strategy day coming up over the next 6 weeks. And Chandran, I really enjoyed your talk, so probably would be reaching out to you and John for some more advice on that, if that's okay with you guys. But we certainly want to build that culture of mentorship within the organization and learn from your experience and expertise as well. So those are my top tips. Thank you.
Thank you, Vikas. Thank you for your time. I'm sure breaking the ice between the mentor and mentee definitely falls in the top agenda in a mentorship program. Dr. Jennifer, your top tips?
Yes, I think, ideally it's great to have opportunities like Vikas's relationship, but in reality, it isn't always that easy to find those really strong, long-lasting mentorship opportunities. And I would encourage people also to think about mentorship in the moment. You don't have to dedicate a huge amount of time to inspire someone to consider pursuing a career. And they may have many smaller mentorship opportunities along the way. And I'd also encourage considering the mentorship and the sponsorship as well, because looking for someone different to you to take on a role or to promote someone who is not well represented in your committee or your board is a really important opportunity to develop diversity. So my top tips are: consider just short mentorship opportunities. There are minorities around your organisation, in our universities, in our hospitals, who are very inspired, and I've heard many talk about just having someone from the profession spend a bit of time with them. It doesn't have to be a huge amount of time. In Canada, they've also had the Mentor for a Day, and that has been a huge success. So I just don't want people to think that they have to dedicate a huge amount of time as a mentor. Just a small amount of time is so beneficial. Just taking the time to talk to someone, to go through something with one of your trainees and have a personal relationship for even a few minutes, it is very valuable.
Thank you, Jennifer, Dr. Jennifer. John, can you share your tips?
Yes, I was very impressed with all the talks and very grateful to be here. I think the most important thing that hasn't been really spoken about is training mentors. Now, there is a difficulty here. It's like saying, do we want professional parents? And the answer to that is absolutely not. But we do need some training, and mentors do need a certain amount of training. It's not just the matching personalities. It's not just the ability to ask questions. It's not just the ability to have a point of view. And I think we have to think carefully about the suggestion of collective mentoring, which I'm very much in favor of. But I think we have to think about how we're going to get a level, not a series of exams, but a level of standard of level which is acceptable for mentoring practice. It is important. We have difficulty getting mentors ourselves because so many people are unable to adapt to the needs of being a good mentor. That's the truth.
Dr. Valeria.
I will stress the necessity. I was muted, sorry. I will stress the necessity of training. Training and feedback is of the essence. And build a mentorship program that suits your very needs. It doesn't have to be, I will agree with Jennifer, it doesn't have to be a fancy program, an extensive program, 1,000 people program. It should be based on your needs. It could be small, it could be one-to-one, it could be very tailored to your necessities, but it should be present, and some mentoring is better than none. And I believe that those will be my two tips.
Thank you, Dr. Valeria. Dr. Chandran?
I'll just say, make one recommendation, and that is that many people who need guidance don't know how to ask for it or are reluctant to do so. And I think one very good thing we can do is encourage them to seek it. Sometimes maybe in very simple ways by, for example, encouraging them to write or communicate or connect with other people in their own professions, or whether those are more senior to them or more junior to them, because this is how they're going to get the guidance that they need. Of course, one can always reach out as a potential mentor to people, but we can't mentor everybody. We don't have the expertise to guide them all, but we can encourage them to build their own connections, their own networks. So I think this is something that, especially those who are in very senior positions of leadership, positions where they run departments or schools, this is one thing that they can do for especially their junior or mid-level colleagues, and say to them, why don't you get in touch with so-and-so? This could be very, very helpful to you. Oh, but I couldn't just get in touch with someone at random like that. Of course you can. You can write to people. Most people are probably more than happy to help. In fact, they're probably chuffed to get a request from someone. It's flattering. This is a simple way in which you can build that connection. I think if we can encourage people to do this, that will make a big difference.
Thank you, Dr. Chandran. Dr. Gau, you have some comments to make.
No, I think I would just summarize some of the learning points that I've picked up from this webinar. I like the term collective mentoring. I'm going to go and read up around that. I think that's something we can certainly adopt in the orthopedic circles, or at least within our organization. John very clearly highlighted that a lot of mentees and what they're looking for is someone to be able to listen, ask the right questions, and be relatable, but also the importance of us not forgetting mentors, their training requirements, and supporting them so that they're able to actually provide that service. I think that's important. And Valeria talked about training, and I think that's also important within the organization. And finally, Sasi, you touched on how we don't all have to fail, and we all can actually have a more strategic and focused way to get from point A to point B. And perhaps one of the ways in doing that is having a very structured mentoring regime. So I think there are lots of learning points, and I would certainly want to listen to this in a recorded version and go back and read up around it. But thank you very much. Thank you.
Thank you, Gau. We have two quick questions. The first question is for Dr. Jennifer. So the question is, I am a female medical student who wants to become an orthopedic surgeon in the future. There are many mentorship programs, but they are mostly for the young surgeons. My question is, how can a student find a mentor? Dr. Jennifer? Dr. Jennifer, you need to unmute yourself.
Sorry about that. There are many women in orthopedics organisations around the world. I think we're now up to over 40 in various different nations. So she can reach out to her local women's organisation, or if she is unable to locate them, if she goes to the orthopaedicdiversity.org website, she can find a list of them on the bottom of our homepage, or contact us on info@orthopaedicdiversity.org, and we can put her in touch with someone local to her. Thank you.
Thank you, Dr. Jennifer. We have another question. If during a mentorship program, it is seen that nothing is working well, what should a mentee do? I will take this question. First, it's required that the mentee introspect himself or herself. You need to identify what exactly went wrong or assume possibly went wrong. Then subsequently, it is best to communicate with the mentor what the mentee feels and what is the expectation of the mentee. Possibly the goals were not set right, they were too big. Possibly the goals have to be set again, or the mentee can even have additional support or consultation with other people who can also assist to see if there is something salvageable in this relationship. But if these are not working, then you should set a step back and leave this relationship. If it is toxic, it's not good for you. It's not good for the mentor either. It's not serving either's purpose. It is best that we regroup to another mentor and another mentee to make it successful. So that's about this. And Dr. Valeria, I request you to give the conclusive remarks.
While I share my screen, I will very much like to thank you, Sassy, the SICOT presidential line, and all the excellent panelists we had. This was a learning opportunity for me at least, but I believe to all that we attend, and we'll sure we'll go on and read about all these concepts one more time. So I will put together some remarks of each talk. I think a concept that we explored was to spend time with the mentor, build the relationship. It doesn't have to be a huge amount of time. Short mentorship opportunities should be taken into account. Jennifer talked about the mentorship for a day. That was a very successful program. But you could mentor and you could be mentored in a variety of opportunities. Mentorship ability is not built in. We should be trained. We should offer training to our mentors, and that should be part of any structured program. Institutional mentorship programs that could be built into our institution should be a spot to investigate and to look after. I think this was probably one of the most interesting remarks of all the talks. Mentorship should be challenging, should be questioning, should be it's not a and I'm sorry, I don't find the right answer, but it's not built in ourselves. We sometimes are not trained to be mentors, so this awkward relationship that sometimes are given into a mentorship mentee pair should be challenging, but toxicity and relationships that don't work should be identified and be quit. And guidance and mentoring help shaping our professional pathways. It should be actively seek. Sometimes we don't know how. These events give us the opportunity as listeners to get to know where to find our mentors. So thank you all very much. Thank you, SICOT. Thank you for your the space and for the excellent talks.
Thank you very much, Valeria. Sofian. Thank you very much, everyone. Thank you for attending this program. I'm sure this would have been very helpful in your career. Please fill out the post-webinar survey and get the certificate of attendance. Also, we would like you to answer this survey that is aimed at giving the best for you by SICOT. Thank you, everyone. Again, thank you, Jennifer and Valeria, on behalf of IODA. Thank you, Gao, for helping me organize this. Thank you, John. Thank you, Dr. Chandran and Dr. Margaret. She has left. Thank you.
Thank you for having me.
Okay, thank you for having me.
It's been a pleasure.
Thank you all.
Good night. Bye-bye.
Bye
Bye
bye.
all. Good night.
Good night.
Goodbye.
Good night.